Do you get really bloated, have stomach pain, find yourself burping or passing gas, and you're like, what is going on with my digestive system? Like, I have never had issues like this before. Or you've been told you have IBS, like you're always worried where the bathroom is. And or maybe it's more diarrhea, not so much constipation, or vice versa. You might have SIBO. That's SIBO. That stands for small intestinal bacterial overgrowth. And what that is, it's abnormal growth of bacteria in the small intestine. And normally the small intestine has a low bacteria count compared to the large intestine, which is near the colon, near the rectum, etc. Right? So in SIBO, the bacteria in the small intestine is usually found down in the large intestine. It's not way up high in the small intestine. So this can lead to a variety of digestive complaints. So what are the causes? Well, for me, what I see with patients, usually they travel to, say, another city or country, they're enjoying the food and the water there, and they come home with dysbiosis, or normally bacteria that's not in their digestive tract. Or they're on multiple rounds of antibiotics or even one round of antibiotic because it's not only killing the infection, it's disrupting the bacteria that normally lives in our gut and helps us digest food, helps protect us, helps with our mood, helps with neurotransmitters. It's kind of amazing. So what are some other causes? Well, impaired movement or motility. Well, say you've had, I don't know, a surgery or food poisoning or something that changed how the motility or the movement of your gut has been affected. So they call it the MMC, the migrating motor complex. So you've got your muscles squishing your intestines, keeping things moving. And when that's disrupted, yeah, that can cause an abnormal amount of bacteria to grow. So usually these muscle contractions sweep those bacteria down into the large intestine, and that's why we don't find it in the small intestine. So when that's messed up, when that broom goes away, in so many words, you could have a problem. Yeah, so I'll see that a lot with even medications that slow down motility. Yeah, there are there are those medications, and like I said, surgery, traveling, food poisoning, stuff like that. Other things like after surgery, like say if a patient gets what's called a fistula or a stricture or even surgery like gastric bypass, that can create little pockets and blind loops where bacteria can grow and cause problems. And I know myself dealing with diverticulitis, that is not fun. So that's one reason as well. And then disrupting stomach acid. So if I have a patient that saw a practitioner and they're on Prilosec or Prevacid, or they're constantly downing the Tums, the antacids, when you reduce your stomach acid, that can be a problem because stomach acid helps kill bacteria. That's right. So you have to be really careful with the long-term use of proton pump inhibitors. There's another video I put out on this channel. I think I titled it Dementia and Taking These Medications. I talk about those medications. So it's really important to support our stomach acid. It's like one part of the immune system, really. Okay, so that can increase the risk of SIBO as well. People with pancreatic issues like pancreatic enzyme deficiency, that can lead to bacteria just flourishing in the small intestine because the pancreas produces enzymes that don't just aid in digestion, but also have antibacterial properties. And boy, do I love taking a digestive enzyme. In fact, I took one last night. I was so bloated and full, and I just could not lay down. So I took a digestive enzyme. It's just this little natural chewable tablet. Felt better in 15 minutes. It was great. Yeah. So a weakened immune system can also cause SIBO. So if someone's dealing with an autoimmune disease, or they're fighting off an illness like the flu or COVID or whatnot, like anytime the immune system is taking a hit, yes, you may be at risk for SIBO. So what are the symptoms? I've kind of talked about some of them. So, it's the gas. It's the worst thing. The belching, the bloating, the abdominal distension where, you look like you're about to have a baby and you're not. Yeah. Diarrhea, constipation, we talked about that. Not everyone gets pain, but some people do complain about the cramping and abdominal pain. Nausea, acid reflux may be a symptom. And then even a nutrient deficiency that shows up on lab work. Why? Because bacteria actually will consume these vitamins and nutrients. And then it looks like you're low in vitamins on your lab tests. Particularly B12 and iron. So if you've ever been told you're low in these vitamins, it could be due to SIBO. But these deficiencies in vitamins, do you know this can also lead to anemia and other problems? So you want to get that checked out. There can even be weight loss. In severe cases, malabsorption of nutrients can lead to unintentional weight loss. It's true. And then finally, fatigue and brain fog. Yeah, if your doctor has gone through everything, well, it's not menopause, it's not the medications you're on, it could be this, it could be SIBO. So luckily, there is testing. Yes, there is. And it doesn't hurt. So the most commonly ordered test is a breath test. You're literally like breathing into these little tubes. You send them off to the lab. It lets you know. And lab companies like Sonora, LabCorp, Quest, they do that. But there's other third-party lab testers, like if your insurance doesn't cover it, like I've used the Genova company, I've used Trio Smart, and we'll have some other companies that the ones that are probably that we trust the most and are the best price, we'll try to put them soon on our website. They're not on there yet, but we're going to try to get that attached soon. Well, it's looking for the gases. So you breathe in these tubes. You could have a hydrogen dominant type of SIBO or a methane dominant SIBO. And now there's even a mixed type. So there's really 3 different types that could flag you as positive. There's more to that, but we'll keep with the basics on there now. Sometimes GI doctors or your primary care doctor will even just do a small bowel aspirate or a culture. They'll literally take a piece of your gut or a piece of the stool and test it for specific bacteria. I've used that testing too. It can't specifically diagnose SIBO though, but I love how it gives me an information panel, like all the results of exactly what bacteria reside in your gut. That test exists, and I feel it's very valuable because then you know what's causing the problem. I think that's great. Well, let's get into treatment. So your doctor gave you the test, or you've ordered from a company we recommend, whatever, decide. I don't know which way we're going to go with that yet, but I do like using Trio Smart. That's one company I do like. The first line treatment in mainstream traditional medicine, of course, is an antibiotic. It's called Xifaxan. This is also known as rifaximin. And the nice thing is it's primarily absorbed in the gut, and it's not well absorbed systemically. So it's not going to go all over the body, supposedly, and just work in the gut. And so I think that's a really great thing. But if it's a methane dominant type of SIBO, rifaximin may be combined with sometimes neomycin, sometimes metronidazole, which is also called Flagyl. So I'll get to the natural treatments in a second, but in traditional medicine, besides an antibiotic, the doctor may recommend a low FODMAP diet, which means you're eating foods that reduce the source of fuel for bacteria. And so we call these the low FODMAP means low amounts of fermentable foods that have certain sugars like oligosaccharides, disaccharides, monosaccharides, and polyols. And then sometimes they'll give medications that help. Remember I talked about the MMC, migrating, say that 3 times fast, migrating motor complex. Like they'll give medications that stimulate the movement of the gut to prevent SIBO from recurring. Okay, let's get into the natural world now, which is something I love to talk about. Believe it or not, they've done a study that show several herbs work as well as Xifaxan or rifaximin. And why is that important? Well, initially when that antibiotic came out, it cost, I'm not kidding, near $2,000. It was insane. Yet we have these very low cost herbs that were as effective in the study. It's kind of great. And I'm not going to go over the exact list. I'm going to go over some of them because you really need to know if you have SIBO before taking these things. That's why testing is important, because sometimes you can do a little more harm than good if you don't need these things. But I'm talking things like oregano oil, garlic, Berberine. Yeah, there's a whole specific list of the recipe to be on for SIBO, but it's all natural and herbal, and I love that so much. Also, in natural medicine, besides recommending a specific amount of herbs to give the patient, we may have them do an elemental diet. Of course, we believe in a low FODMAP diet as well, love probiotics, and doing retesting after treatment is over to see if we have cured the patient instead of constantly throwing things at them. Okay, so that's the nuts and bolts of what SIBO is. Hopefully that was helpful. Comment below if you have a question and we will try to answer it. Again, I don't want to give you treatment guidelines. We're just trying to educate you on what this is. There is testing and treatment for it as well. And gosh, I hope that we can end up putting some affiliate links with testing kits that we know and trust and that I use with my patients too, that maybe you can tell your doctor about. Thanks so much for being here. See you on the next one at Vitalize Health Partners.